Health Hats, the podcast. How do you think that NGOs and advocacy groups can make use of implementation science?
I believe NGOs and communities are the most important players here, because there is a saying, nothing for us without us. I really like it, because who knows better than recipients of interventions. So I believe, yes, scientists, they are doing great role learning and inventing something, but before politicians make any politics, they definitely need to consult with those and foundations, etc.
Where have we heard nothing about us without us?
So non-profit or non-governmental organizations are implementing programs. They have to get support, financial support to do that. They often also have to write reports to funders. Now, if NGOs are involved in implementation science, they can actually provide great resource for scholars. Because mind you, these are people institutions that are implementing
every day.
Programs. So I think having people with expertise in implementation science who are also working with NGOs can help ensure that they don't only improve the conditions, but also they can share the lessons and stuff like that with the scholarly community. So NGOs are particularly key when it comes to implementing programs.
My research is in helping young children with sickle cell disease and their families have access to the services that they would like to have access to. I just want them to be available, and the families and the children can then make the choices that are right for them. So the implementers are both caregivers that have a young child with sickle cell disease, but also, should they choose to go forward with what we call early intervention, the implementers would then be physical therapists, occupational therapists, speech therapists.
And how were they involved in the study design, questions, analysis of data, the process of the research?
So the poster that you saw today, what we were focused on was understanding caregivers' experiences with early intervention and with screening for developmental delays in general, if that was a positive experience, negative, neutral, and if these were even services that were desirable. And so our partners, we mostly partner with the St. Louis Sickle Cell Association, and then also with a federally qualified health center chain called Rosemary Britz. She's the founding director of the St. Louis Sickle Cell Association.
When I'm designing my own implementation research projects, that these people must be involved, because I am one of them.
Yes.
And so actually my implementation research questions come from first-hand issues with implementation as an implementer. And so I naturally draw in implementers into the work that I do.
Yeah, I think particularly with the instrument that we're here, the D&I models framework that we're here showing off, it helps folks that are very limited in implementation science skills to use theories, models, and frameworks. And I think what that does for folks that don't speak the language is aligns the language across multiple groups, multiple levels. So it can bring together groups that have multiple understandings at various levels within an organization and work toward the same goals.
But how are the not scientists accessing and using those tools?
Within this tool, we break down in the plan section, we have a worksheet that kind of helps people work through what constructs are important to them. And so effectively a construct is just a concept that would be important to a group. By breaking it down that way to the simplest part of planning a project, they're able to align what they think is important, choose a theory, model, or framework, figure out if they need to combine it or adapt it, and then figure out how to use it within their project. And then what we're showing off today is the assess section, so assessing whether what they're doing was effective or not.
How do you think that NGOs and community groups could make use of implementation science?
I'm a trained implementation facilitator, and so I see implementation and the implementer's role as they become the subject matter expert about the intervention. The subject matter expert, not necessarily from a healthcare standpoint. They're not doctors, they're not nurses, they're not psychologists or practicing clinicians, but they become the subject matter expert in the process of putting the initiative in place. And that's their role, is to shortcut things, to make sure that the information that's needed by the team, every team member, and varied by the team member and their role in it, is given to them so that they can run with it and get the innovation in place faster. It's the implementer's role to make sure that it happens. I guess on some level it's project management or project management, program management, to make sure the right things are happening, but they have the vision. They have the 35,000 foot vision about what is supposed to happen. When the project people often are very much focused on their role in the process, and it's the implementer's job to see everyone's role and where it fits together into the overall, and provide the resources and the skills and the training and information necessary to ensure the success of each one of those people.
I host, write, and produce Health Hats the podcast with assistance from Kayla Nelson and Leon and Oscar Van Leeuwen. Music from Joey Van Leeuwen. I play Barry sax on some episodes alone or with the Lechuga Fresca Latin Band. I'm grateful to you who have the critical roles as listeners, readers, and watchers. Subscribe and contribute. If you like it, share it. See you around the block.